Good afternoon, ladies and gentlemen, and thank you for waiting. Welcome to the VHQC 2016 move-in call. Please note that all lines have been opened and will remain unmuted for the duration of the call, allowing for open discussion. You may press star 6 at any time to mute and again unmute your individual line. Again, to mute and unmute your own line, please press star 6. Without further ado, it is my pleasure to turn the floor over to your host, Ms. Deb Smith. Ms. Smith, the floor is yours.
Thank you, Laura. And good afternoon, everybody. Happy New Year 2016. Here we are. I would really, there we are. Just making sure that I can advance my slides. Thank you. I want to welcome everyone to this relaunch call. As usual, we have a couple of housekeeping items to go over. So as Laura told you, this is an open call. All lines will be open to promote conversation and sharing among all of the call participants. So if you have a mute on your phone, you'll need to mute the lines on your end. If you don't have a mute option on your phone, you can press star 6 to mute and to unmute. And we know that you're busy and things come up, so if somebody comes in your office or you need to go somewhere and come back, just hang up and call back in because that works too. As always, we're asking you to come prepared to share any of your lessons, learned, successes, barriers, articles, research, breaking news, anything that you would like to share with the group. We're happy to have you share. So this is our VHQC team for move-in. I'm Deb Smith. I'm the improvement consultant for Virginia move-in providers. We also have on the line Carol Whalen, who is the improvement consultant for the Maryland move-in providers.
Hey, everyone.
There's Carol. And then, of course, Rhonda Fletcher is a project assistant for this work, who's actually at the Richmond VHQC offices. And Rhonda's the glue that keeps us all together and gets everybody on the right path and gets these calls prepared for us. So we'll, again, this year in 2016, be asking for participation from everyone on the call, so from you, the move-in providers. Today we need a volunteer for the chat monitor and a timekeeper to keep us on task with the agenda. Is there anybody out there that would just like to monitor the chat for us? It doesn't take much to do it. All you need to do is just keep watching the chat, and then if there is any questions, break into the conversation, and if not, Carol or I will prompt you with asking if there's anything in chat. So is there somebody that wants to step up and be the chat monitor today?
It's really easy, guys. We don't have a whole lot that's going to be in the chat box today. Deb and I may pop something in there, but really it's just helping us realize that there's something going on or some questions that need to be answered.
Deb, it's Betsy Cole. I'll be your chat monitor if you'd like me to.
Awesome, Betsy. Thank you so much. So just keep an eye on that chat for us and make sure that we're not missing something.
Yes, ma'am.
And I think for today, Carol and I can kind of monitor our time together. But just to know that in future calls, especially these quarterly calls that we're going to be having, it's really nice to have somebody who's watching our time because it is just Carol and I doing these calls together, and we're not in the same place. So, the beginning of a new year, it's a great time to look back at the previous year, reflect on our accomplishments, and improve our plans to create an even more successful, productive network of providers who are committed to promoting infection prevention and decreasing HAIs. Our 2015 sharing call plan consisted of monthly sharing calls, quarterly data review calls, webinars as needed or requested by our providers. We were able to, in 2015, address topics such as coding versus surveillance HAI data, We introduced the Targeted Assessment for Prevention program for CAUTI and the pilot Targeted Assessment for Prevention assessment for C. diff. We promoted the VHQC online community where we placed resources for sharing, and we convened stakeholders to partner with us in presenting statewide data trends in CLABSI rates. So it was a great year. We really did accomplish a lot. We had tremendous sharing on the calls, and it was really exciting for Carol and I. But we'd like to modify the plan a little bit since it's 2016, a new year. We want to promote even more sharing on the calls, and we also want to prevent duplication of efforts since MVHIN 2.0 is now in place through the end of the year, and many of our providers are working with the MVHIN. So take a minute to just read these to yourself. I'm not going to read them out loud to everybody, but these 10 strategies for building a partnership were adopted from the Institute for Patient and Family-Centered Care, and they're a great way for those of us committed to infection prevention of HAIs to renew our commitment to each other, and for VHQC commitment to be renewed to you, the MVHIN members. These are great strategies, and you know, it may seem like it's just intuitive, but it never hurts to read them.
Deb?
Yes, Carol.
I think number 7 is on my mind today. You know, for all of us to keep the end in mind and what we're trying to accomplish together. You know, we've gotten to know each other over the last year on our calls, and some hospitals have been fortunate enough to have some face-to-face time. And so I think, you know, when we think about the work that we're doing and how it impacts healthcare and how it impacts patients and their lives and what we do every day, I think we can really be a good source of strength for each other. So I just really appreciate number 7.
Thanks, Carol. I'm sure all of us might have, you know, one of these that just rings a little closer to our hearts. But, yeah, that's a good one. So I'm going to turn this presentation over to Carol now to talk about our goals in the MVHIN network. Carol, the floor is yours.
Okay, well, the next slide that we're looking at here should be very familiar to many of us, all of us, in that we have stressed what our goals are for the project. Last year, we talked about the goals being moving targets in that once, you know, the baseline is changed, then we'll be refreshing these data targets and be resetting our goals again. So at the current time, these are our goals. They're very familiar for CLABSI in each state and then the national benchmark. And our goal is to be below the national and state benchmarks throughout the years we're in this project to 2019. So we see the CLABSI SIR, we see the CAUTI, and the C. diff. And we can see in red where our current performance opportunities are. So, you know, this is where we're focused this new year in 2016, and we're really excited about really being able to roll up our sleeves and get busy. VAE will be added as we move along towards the end of this year and the first of next year. And again, these are benchmarks from 2013 CDC. We are expecting any day now to be having the new goals released sometime in January. We were hoping they'd be released by this call, but they didn't make it. So also, one more thing I wanted to mention is that our data reports, our VHQC trending data reports were sent out earlier today from Sarah Helen. So if you haven't had a chance to check your email today, when you do, you should see an email in there from Sarah Helen with your encrypted data. And for those of you that requested your data be sent by a snail mail, that was mailed out today as well. Okay, Deb. So when we look at our goal for 2015, we were planning what could we do, how can we really drill down and really support our member hospitals in getting the work done. So we take small group goals. And we'll be talking today about large groups and small groups and focus groups. And when you leave the call today, you will have heard us mention those groups several times. So what our goals are for our moving hospitals is to be ranked in the top half of all state hospitals in each state for CLABSI, C. diff, and VAP. So what does that mean? That means in Maryland, all 27 moving hospitals, we would like to be top performers of the 46 acute care hospitals in Maryland. So we'll be looking at the data and determining who's in the top quartile or the top performers of the 46 hospitals. In Virginia, the goal is the same, all 36 moving hospitals to be the top performers of all 81 acute care hospitals. So these are very challenging goals, and we want these challenging goals to drive us and to move us, and we want to be able to say that, you know, our moving network hospitals are the top performers in both Maryland and Virginia. We're really excited about moving towards this goal, and we'll keep you posted how our performance is going throughout the year. If you have any thoughts about those goals, feel free to type them into the chat box, and we'll be happy to see and look at what your thoughts are about it. So to achieve these goals, we needed to put together a transition plan for our group. So if we look at the bottom circles, the circles at the bottom of this slide, we see blue for Virginia and yellow for Maryland, gold more or less. And I tried to pick state colors for those circles. And we see that there's arrows pointing to a green focus group call. So what we want to do is we plan to have small group calls in each state. So Deb will have several small group calls. I will have several small group calls in Maryland. And then any performance issues that we find our hospitals in our small group calls that need additional focus, we'll group together around what the particular issue may be. Maybe it's physician engagement. Maybe it's C. diff protocols or policies. Whatever the extreme challenge will be, we'll work on it together in a focus group. Then these three groups will report up into the quarterly moving calls. Deb, do you have any thoughts about that?
No, you pretty much explained that very well. These calls will be explained further on in the presentation today, but just so that everyone knows, speak up at any time if you have information to offer. This is your network. This is a plan that we're suggesting, but certainly it is not a plan that is set in stone at this point. We're still open to negotiation.
Right. So let's talk a little bit about the quarterly content of what that call will entail. So on a quarterly basis in the past, we've had all of our members call in, and we've discussed topics around our data, looked at our data, looked at our trending. We looked at how we compared to others in our network. And much of that will continue. This will be a large group call. Everybody will be able to call into it. Data will be our primary focus. We are going to be looking at our progress towards our network goals. And we'll be sharing some of the high-performance strategies that we gleaned from the small group calls and the best practice sharing from our small groups. So also during this quarterly call, we plan to have support for your patient and family group, your patient and family, your PFAC groups at each of your hospitals. And so we'll plan to support that 2 times during the year. So here's a proposed quarterly call schedule. We had to get these dates on with our call vendor early on, and like Deb said, these are certainly not set in stone, and we'll be asking for your feedback on that. But currently we're looking at the third Tuesday, so we're moving that from the second Tuesday to the third Tuesday at 12 to 1 Eastern time. Time frame stays the same on a different day. So these are the dates that would the quarterly call would occur on. Okay, Deb. Next slide.
These quarterly calls then, starting in February and continuing through the end of the year, are where we would be reporting our data and coming together as a group, both Maryland and Virginia providers all together.
Thank you, Deb, for that clarification. So I think Deb's going to take over where our stakeholders are going to be playing a primary role.
Thanks, Carol. Because, of course, VHQC is not alone in our mission to promote infection prevention and eliminate HAIs. We could not do this without the partnership and collaboration of stakeholders in both Maryland and Virginia. So I'd just like to take some time on this call to see if there's a representative from any of these stakeholders on the line who'd like to share an update with us on what's happening in your organization. And I'm just going to go down the list. And then if there's anybody at the end that I haven't mentioned, I'm really sorry, but we will take some time to make sure that everybody has a chance to be heard. So the Maryland Department of Health and Mental Hygiene, is there anybody on the line representing MDHMH?
If you are on the line and trying to speak, you may be on mute. So make sure your line's unmuted.
The Maryland Healthcare Cost Commission. The Maryland Hospital Association. The Maryland Patient Safety Center. The Virginia Department of Health.
Hi, Deb. It's Andrea. Can you hear me?
Hi, Andrea. Thank you.
Hi. Just one save the date for folks. We are planning a webinar on February 20th during the lunch hour, 12 to 1. Perhaps you were already going to mention that, Deb. So we're still in the planning phases regarding the specific content to be included in this webinar, but it will be related to the National Healthcare Safety Network, some surveillance updates for 2016, and some kind of tips and pointers to get everyone off on the right surveillance foot for the new year. So again, that was February 10th from 12 to 1, but more information to follow.
Sorry.
Question, comment?
Yeah, I put down February 20th. I'm sorry, everybody. Either. Can't talk and type, can't listen and type. So it's February 10th from 12 to 1. And this is a VHQC Virginia APIC sponsored webinar.
Okay. And other than that, no updates from the health department.
Thank you. How about Virginia APIC?
This is Sue. I don't know that Marsha's on the line, but we're just in with VDH, in the planning for their program.
Thank you, Sue. And just to introduce, Sue Moslin is the new Virginia APIC president for 2016. So welcome. Thank you for being on the call, Sue. And well, I know Betsy Cole's on the line for VHHA, which is actually also the HRET VHHA HEN. Betsy, any updates?
Yes, Deb. I just want to share with the group that the VHHA is hosting our annual Patient Safety Summit February 4th and 5th in Richmond, and registration does close at the end of the week. So I will put my contact information into the chat, and if anybody wants to get registered but hasn't, can get in touch with me. Also, I want to share for all of the HAIs, there is publicly facing resources through the American Hospital Association, through the HIN, and mostly change packages and webinars, and I'll be happy to put that information into the chat as well.
Thank you, Betsy. And for everybody out there, all of our providers, I want to thank VHHA, HRET, the Hospital Association, who have shared all of their tools and resources with all of our providers, regardless of whether you're signed up with them for the HIN work or not. And other HINs like Premier have done the same thing. So it's really helpful for us all to work together. Nobody needs to be reinventing the wheel. So is there any other stakeholder updates out there? Anybody else that would like to let us know something that's going on in the state, Maryland, or Virginia?
Hi, Deb. This is Eileen Witherspoon. Can you hear me?
Hi, Eileen. How are you?
Hello, Eileen.
Hi, how are you? Sorry I was on mute. We don't have any updates, but I just wanted to let you know that I was on.
Okay, thank you. I appreciate that. I know. I never know how long to wait.
Yeah. I thought I pressed the right button, but apparently not. So.
Yeah, I do that same thing. Well, thank you, and thanks for attending.
Okay, thanks a lot.
Anybody else?
Hey, Deb, I wanted to find out if there's anybody from the Maryland Greater Baltimore APIC that's on the call that may want to put in a soundbite for the meeting scheduled next Tuesday. Okay, well, if not, I will then. There is a scheduled meeting for 2016. I talked to Stephanie Mayork, who is the president of the Greater Baltimore, Maryland APIC organization, and there will be a meeting next Tuesday in Columbia starting at 12:15, and I think it's probably going to be going till about 2:30 probably.
Thank you so much.
So if you guys want more information, I'll put that in the chat as well.
I'll be glad to.
I'd love to have you join the meeting. I will be there, by the way. I'll be in Maryland next week doing site visits, so I'll get to attend that meeting. I'm excited about it.
Great. So anybody that attends the Maryland meeting, the APIC meeting, will get to meet Carol.
Yeah.
Okay. Is there any more updates? If not, we're going to move forward to our first polling question. So our goal is to have 100% participation, commitment, and partnership. We don't want to just be preaching to the choir type thing. We want everybody to be involved. So these quarterly calls that we've scheduled starting in February are where we'll be reviewing the move-in data, sharing the work being done on the small group calls that you'll hear about shortly. And remember, these calls aren't just for infection preventionists who have historically been responsible for infection prevention in the hospital, but these are for all staff who are dedicated to preventing infections and part of your infection prevention team. So if you could just answer this polling question, will you or another representative from your infection prevention team be able to commit to attending this quarterly move-in call? And answer yes or no, and if you're answering no, if there's some barrier that's preventing this from happening, we'd like to hear about it. So has the poll been posted?
I'd like to say yes, but I can't because, oh, there we go. Never mind.
There we go. Okay. Thank you.
Deb?
Yes.
This is Bonnie Big Green with Chesapeake Regional.
Yes.
For some reason, I wasn't able to get onto the WebEx, so I'm telling you yes.
Oh, thank you, Bonnie. Okay. I am going to mark you down as a yes.
Okay.
Thank you. You got the slides, though, so you're able to follow along with the slides?
Yeah, I got the slides, and I've never had any trouble getting onto the WebEx before, but all of a sudden it's telling me my browser won't allow me, so we'll have to get that fixed.
You are having some major problems with your system. I wonder if they just put in some kind of special security.
You know what? I don't know. We definitely need an upgrade.
Hey, Deb, this is Sherry Merrick.
Hi, Sherry.
Hi, can I just send you an email because my Korean's done something and I haven't been able to get on for a long time, so.
Oh, yes. You can definitely send me an email. And actually, that's a good idea for anybody. You do have mine and Carol's email, so if there's others out there who are either calling in because they're on the road or at home or anything like that, answer these polling questions and then just send them on to us by email. That's a great idea, Sherry. Thank you. So it looks like out of the 39 participants, we did have 18 that didn't answer. 19 are able to attend or send somebody in their place, and there's just 2 who aren't. So hopefully those 2 will let us know if there's something we can do to assist with that.
And Deb, we have 35 people on our call today. 39 people on our call today. So I just want to say thank you guys for finding time out in your schedule to be on the call. And
absolutely. So we're going to move on and talk about these small group networking calls. So where the quarterly calls will be held with all the move-in providers from both states. The small group networking calls will be set up more like a virtual workshop meeting. So this will be your chance to network in a small group setting, similar to the breakout sessions at a workshop. So there'll be some structure to these calls. The majority of this call will be devoted to sharing between the participants. So topics such as tool review, what's working in your hospital, what barriers you're facing. If you have 0 events over the last quarter, what new processes did you put in place that might have impacted those outcomes?
Deb, we have some background noise. If people would please double check your phone and make sure it's on mute. We're hearing some talking in the background. Thank you.
Hello? There's somebody who's still not muted. Talking to someone in their office.
Maybe Laura can mute their line for us.
Yeah, Laura, if you can figure out which one is still open and muted, that'd be great.
And as a reminder, please do press *6 to mute and unmute your individual line.
Thank you. So, like I was saying, if you do have 0 events, so if you haven't had an event over the last month, you'd be able to share with the group what processes might have impacted those outcomes. And if you have had an event in the last month, you'd be able to present it to the group and possibly discuss future outcomes or things that the rest of the group might be able to help you with. The 2016 plan to provide the opportunity to network this 2016 plan, will provide you with the opportunity to network monthly with peers in a small group. And then we would quarterly come together and share what's happening in these small groups with both states, so it would benefit everybody. So we're going to come to our polling question number 2. So when we talk about these small group calls, they would for sure be in between the quarterly calls. But we did want to know if you thought that you would prefer to have these quarterly sharing calls be in addition to or in lieu of the monthly small group call. So on those months where we did have a quarterly sharing call, you would have 2 calls, but one would be the workshop small group call, and the other one would be the data review, quarterly data review, and sharing with both states. So Carol and I really didn't want to make this decision for the group, so we'd like to know what everybody is thinking about this. And once again, if you're not on the webinar, please just send this in, like you can send one email with all of these polling questions on it. And you should have had these polling questions in the handouts that were sent to you earlier.
Yeah, Deb, while they're answering this question, let's talk about why we were looking at small groups this year. And one of the reasons that we were we're looking at small groups is because we really wanted to enhance our sharing. And sometimes people, when you have a larger group, people don't feel as comfortable to share, and they're not as apt to speak up, maybe because they figure there's plenty of other people on the line that can talk, or they're just not comfortable in the larger group. So that's part of the rationale as to why Deb and I were really looking at providing these smaller group calls.
So actually the polling for that in lieu of or in addition to was 14 out of 40 that answered were in lieu of. So Carol and I kind of thought the same thing, but like I said, we didn't want to make that decision. And certainly if we move forward in the year and find that those calls are, need to be kept every month, we can do that. So this next question is, during the quarterly data review calls that we have, we'd like to really get a feel for whether the groups thought that data transparency would be helpful. I know Carol and I have talked about it many times, and we feel like it's a vital component of group sharing and a critical factor to success for us to reach our goals, for us all to be transparent with our data. But, of course, with the VHQC letter of participation, that really wasn't clear. So we're not able to be completely transparent with our data. And when you get your aggregate data showing you where you are within the network, it is blinded. So we're just wondering if you thought your facility would be willing to sign a data transparency agreement. And it looks like 25 did not answer. But I know quite a few of you are not able to. And 6 out of 39 said yes. There is one no, and 7 maybe. So maybe just think about this moving forward, and the rest of you that didn't answer, contact Carol and I to discuss this.
So, and this would also, this would be, nobody would be forced, or it wouldn't be a mandatory thing that you sign the data agreement. It would be something that, a lot of times the people that are on our calls aren't the decision makers with that particular thing. So you may not be the decision maker in your hospital that could answer that question, but, you may have to get higher up authority to answer it. So.
Hey, Deb, this is Diane Jones.
Hi, Diane. How are you?
I'm fine. How are you?
Good.
Just to let you know, the voting button, it times out really quick. So,
okay.
I don't know what the time limit is on that polling question.
Okay.
We'll
address that moving forward. But so anybody that didn't get a chance to vote on that or give your answer, please just email us or put it in chat. You can put it in chat also.
If you're willing to be transparent, of course.
Right, yeah.
Since we're talking about this.
That's true. But you can send us an email also. So while we already have the dates planned for the quarterly data review calls, and they're going to be the third Tuesday of the month beginning in February, and then continuing quarterly throughout the year, we haven't planned the dates yet for these small group calls. So these calls are going to start in March, and once we've established the groups, we'll be sending out a doodle poll to each group to set a date that works for the majority of the group, because obviously with a smaller group, we'd be able to be a little more lenient and more specific with the time schedule. So we're also adding another call this year for 2016, and this is a focus call. So these calls will be more on an as-needed basis, and they'll be dedicated to a specific topic that's been identified through the small group calls or the quarterly sharing calls. These focus calls could be deep dives in RCAs for a specific case study, or a call to promote a strategy such as the TAP baseline assessment, and they could be as small as a single provider or as large as the entire network. So just keep your eyes out, more to come on those focus calls. So this is the small group assignment that we're proposing for Virginia. Keep in mind that these groups for this year, for 2016, were formed also to prevent duplication of work and efforts with those providers who are also working with the HIN in 2016. So as you can see here with Virginia, there's 2 HINs in Virginia that are working with VHQC providers also. So the HRET VHHA HIN has the most overlap of providers with the VHQC network. And then the LifePoint HIN also has hospitals in Virginia, and those and then there's those hospitals that aren't participating in any HIN activities. We've put in the VHQC group. So take some time, look at these assignments. We're open to feedback. This isn't a done deal yet. We're open to all suggestions for these small group assignments. We were just trying to really prevent duplication of efforts. We want to collaborate with the HINs in these calls, so they'll either be combined calls or substitute calls, the HIN calls for the small group calls. We don't want to create an even more hectic schedule for our providers who are working with both of these groups. We know that you all have a tight schedule. So here again, think about using your hospital infection prevention champions and other team members to attend these calls if your schedule doesn't allow you to attend. We're really trying to push for a team effort this year. This can't just be done by infection preventionists. So anybody have any questions or comments?
Deb, why don't we talk about, we've talked a lot about the HIN. Let's talk about what that is, because we may have some folks on our call today that may not be a familiar term to them.
Okay, go ahead.
So the HIN is an acronym really for the Hospital Engagement Network. It's a federally funded project that has reemerged from a previous 3-year project, Partnership for Patients, which was and is now a project funded by CMS to support reduction in harm and readmission. So HAIs fall underneath preventable harm, and so that's where the focus is coming from, this other entity called the Hospital Engagement Network. And I think there are about 14 this year, somewhere around there. And maybe don't quote me on that number, I may be wrong, but if somebody knows the accurate number on that, let me know or put it in the chat. But it's easy to look up. So we are charged, the HINs are charged to collaborate with the QINs to reduce this duplicative work. So when we speak of the HIN, it can have a name like VHHA, HRET HIN, it can be the Premier HIN, it can be the LifePoint HIN. Those are the 3 that we've identified and put in our network. If there's other HINs that you know of or are participating with, please let us know that too.
Okay. All right, thanks, Carol. That was evidently very well appreciated and needed. So I'm now going to turn it over to Carol to talk about the small group assignments in Maryland.
Okay, so all of our Maryland members, this is the division that we currently have for our small group assignments. So we have hospitals that have private vendors through Quest, and then also are participating with the Premier HIN. And those hospitals will be setting up their calls to align with that work. So if you see your hospital name in there, that will be your group, and that will be your focus group. Focus group is probably not the best word to use, but that will be your monthly call group. And then the Partnership for Patient HIN, that are hospitals that are in a HIN but not a part of Quest, we have that group. So we have 3 hospitals that will be joining together in a small group call for that group, should we continue on this plan. And then all of the other hospitals that have not identified themselves as participating with a HIN in Maryland, then we will form our own small group call. And those hospitals are listed in the third block there. And as Deb said, you know, this is our first plan. We're open to suggestions and very flexible to meet your needs, whatever your needs are. Okay, so we have our fourth, I believe this is our final polling question of the day, and it is about your ability and willingness to share. Are you willing to be highlighted for best practice, high performance, etc.? So we want you to think about, you know, where your performance is. If you're willing to be highlighted, we want to give you the opportunity to share your success with others and bring others along. Also to give you some possible of national exposure in sharing your success for your hospital and for all your hard work that you've done to achieve success in these areas. So please take a minute
and you can pick more than one answer here too. So
right.
If it's yes, then is it yes for all of the above or something different? So pick as many as you're willing to share with.
One thing while we're waiting on them to finish this question is that going back to some of the transparency and willingness to share within our group structure, you know, I have had the opportunity to link some hospitals together that wanted to have some requests to say, hey, can you tell me who's really doing good in this area? I want to talk to them. And so I can go in and I can look at our data and I can see who's the best performers in this certain area. And then it's quite a laborious process to have to contact those hospitals independently, separately, ask them if they're willing to share, and then go back and then link them up together. So although it's something that we can do and we will do, we're happy to do it. If we're transparent with one another, you can just go in on the list and look for yourself. Hey, look at this hospital. I want to give them a call, and you can do that. So it looks like we have the results. Deb, you want to go over the results?
Guys, this is Sue. Could I just point out that I answered it, but then I looked up and your question in your slide says, are you willing to be highlighted for best practice? But then if you look at the question on the other side, it says about being transparent. The questions are the same.
I'm here.
Yes, that's true. I see it. That's a glitch, I guess, in the slide preparation.
Oh, I see what you're saying. Okay. We'll talk with WebEx about that. But yes, this question right here is not about being transparent. This question is about being highlighted. So hopefully everybody answered it for being highlighted. And it looks like there's only one no and 11 maybes. So moving forward, if those of you that were no and maybe could just let us know what we can do to assist. This is a big part of what we're trying to establish as a sharing network.
You know, and this might be a question that we can take to our small group, Deb.
Yep. Okay.
Was there somebody else that had a question?
Yeah, this is Betsy. There's a comment in the chat about the Maryland small group assignment that Meredith Medical Center isn't on the small group assignments.
Meredith. Okay. All right. Well, let me double check that, and I'll get back with you guys. Thank you for that feedback.
I do want to tell you how hard it was to fit all of the names on those little blocks, where it looks really nice. I had trouble getting all the names on, so.
Right, it could have been, it fell off on the slide, so I will double check and get back with you.
Thank you for bringing that to our attention, though. Thanks.
So when we look at data, we mentioned earlier, just to recap, you know, that we will be looking at data, as we look at actionable data, we want the data to point us in the direction of where we can get the biggest bang for our buck and where we can get the biggest focus. So just to remind everyone what our data sources will be this year, of course, will be around the TAP, which is the Assessment for Prevention Strategy, and the TAP reports that we received from the CDC. And then we'll continue to be providing the tracking monthly progress reports through our VHQC monthly reports that also provide unit-specific data and also shows you the trend with your with the SIR for each area in Claudia, Classy, and CDEP. Those are very meaningful reports. Once you drill down, I have some hospitals that actually take those reports to their report up, their one-up, and they can easily show the progress of the group or progress of the unit that they may be focusing on at the time. And then we're going to be adding some event tracking, and that will probably fit in with our small group calls, maybe with some of our focus groups as we begin to look at event numbers and how to put together our focus groups to really be able to push past those barriers that are preventing us to getting to where we need to be at our hospital. So actionable data. Another important reminder on this slide, we're really excited that we reached 100% through October in the month of October last year with our 30-day reporting into the NHSN database. So we were really thrilled about that. We just finished the November data cycle. What we do is we pull the data towards the end of the month to identify those hospitals that still may not have all their data in, and some of you, not a large number, but some of you hospitals get a really nice reminder, reminding you that there are some units that the data is not in, and offering assistance to help if you need help in getting that process completed. And so once that's done, we really try to give everybody the opportunity, providing help with reminders to get all of our hospitals data in 30 days out. So we're really happy with the progress we made. Look at that. When we first started tracking this back in July, we were 76%, 63%, and by October's data, we were 100%. I think we had a few out this month, reasonably. When you have staffing changes, that's a reasonable expectation that you might not be able to meet that deadline.
Well, and there were some glitches in NHSN this month. I know there was almost a week that I couldn't get in NHSN, and then some of our hospitals have had other issues with their internal IT. So we certainly understand those glitches. We're just trying to, as much as we can, get 100% reporting, and it's for that aggregate comparison. Because if we don't have 100%, that's not a good data point to use. Sorry.
No, that's great points to remember. So why is that so important? It's so that we have accurate comparison data, So we want to remind everyone about our online community. I've gone out and checked the online community, and we are in the process of validating our members. It seems like we haven't had our membership number to grow in the last couple of months, so we're trying to figure out what's going on with that. But just so you know, the calls are recorded, our educational events are recorded. We added an educational tab to the website, so if you're looking for a particular education recording or resource, you can just go straight to the education tab, and it will pull up all the educational resources that we have out there that are recorded and the links to those. So just a brief reminder, anybody can sign up, your entire team can sign up, and it's a go-to place to catch up if you've missed a call or you need additional resources.
Yeah, and Carol and I have been talking about, instead of sending out like the agenda and things for the call, to be able to put it on the online community. But I do know that there are some of you that can't access this from your hospital's websites and computers. So we do understand that. And then just to remind everybody that once you've joined the online community, to also join the HAI group.
So speaking of education, I want to just give you a high-level overview of what we have planned for the year so far and be looking for educational HIN events. These are exceptionally good, great resources for team focus. So we'll be sending those out to our hospitals. Deb and I have worked out a plan where we'll send you a calendar invite. You can accept or decline, or you can forward. That is HAI-related educational events that we are privy through our HIN partners. So what webinars have we put together at VHQC for this year? We're looking at sharing. Greater Baltimore Medical Center has an excellent successful lean strategy to reduce CAUTI, and we're shooting for March for that presentation, and thank you, Greater Baltimore, for being willing to do that. Dr. Michael Stevens will be sharing and teaching on antimicrobial stewardship, and then we have Carillion, who is scheduled to be sharing their CAUTI reduction program with the patient education video. So these are all really innovative, high-performing hospitals with success all around them in these areas of prevention in HAI. So that's why we wanted to ask you guys. We know a lot of our hospitals have success stories, and we want to give you credit for all that hard work, and we want you to have the opportunity to share as well. So 2016, keeping it real. We have all these plans in place. We have all of the resources available to us. We have consulting experts and expert speakers and excellent teachers and hospitals presenting, and keeping it real. What calls can we be on? How can we push this information to our teams? How can we get this information out, disseminated to the frontline staff where the harm really occurs, where the hands go on the patient? And how do we engage our nursing leaders and our leadership within our hospitals? So we realize the challenge that our members have. Deb and I have been there. We've understood that, and we know how hard it is for you guys to prioritize your schedules to participate in this, and so we just want to keep this work real and what is going to work for you to get optimum results. Any thoughts, additional thoughts, Deb?
Well, I'm interested in hearing from anybody in the group. We've got 5 minutes left, other than me telling you to fill out the evaluation and make sure that you let us know what your needs are for the future and, that type of thing. Is there anybody that would like to comment on this structure that Carol and I are proposing, or do you think quarterly calls? I know one of the things that we wondered about was if bringing the two states together quarterly, is this enough to really still promote active sharing between the two states? Does anybody have some thoughts on that? Hopefully it will still promote that sharing. We went through a lot of different scenarios on how to break down to those small groups. So what about those of you who are participating in the HIN? Do you think that this structure with the small groups and including all the HIN hospitals together, do you think that's going to help you with alleviating some of even the concern about duplication of efforts? Someone who's in a HIN.
Deb, can you hear me?
I can.
This is Deborah in Martinsville.
Hi, Deborah.
How you doing?
Good.
And I think it will help. I also just want to let you know that on one of those polling questions, it recorded as a maybe. That's not what I hit, but evidently when we had that snafu with the problem, it took my answer from the previous question. I just suspect that might have happened with a lot of those maybes.
Oh. We'll talk with WebEx, and then maybe we'll send these polling questions out like a Survey Monkey after the call today. I mean, I've been thinking about it in my head, and that might be the best thing to do.
Yeah, Deb, I agree with you. I'm not sure that our polling results are going to be reliable at this point. There's some kind of glitch that's going on today. I've never seen this happen. In all the calls that I've been on and been a part of, I've never seen the polling questions do that. So, yeah.
Okay. So is there anybody else out there that just wants to make another comment? I mean, Carol and I really want to know what you need to accomplish your goals. Like, what are your goals? We have network goals as far as data is tied to it. But what do you need that you're not getting now to accomplish that work? And whether you answer it today or think about this for later, just to know that we're open to suggestions.
I need another FTE.
I know.
I was waiting for that one.
I bet you're not the only one.
You're the one who's bold enough to speak it out there. Thanks for keeping it real, right?
That is the truth. So last chance, everyone, either in chat or anybody that wants to speak up on the call. So you will be hearing from Carol and I as far as the small group call schedule goes. And once again, just continue to think about your patient-family engagement. We'll also be calling you about that because this is our deliverable month, so we still need to discuss patient-family engagement with some hospitals. The next quarterly call is Tuesday, February 16th, so we'll be reviewing data. If somebody wants to step up for chat monitor and timekeeper, just let me know or let Carol know in an email. And we're going to be relentless with this. Invite your team members to join you on these calls. We really need this to be a team effort.
And Deb, I just wanted to add one thing. I will be in Maryland next week. I'll have these 6 hospital visit suite through Maryland. I'm really excited. Some of you I'll get to meet face-to-face for the first time, and we'll be doing some intensive focus with our TAP strategy tools. We've had some surveys, some assessments that have been completed, and so we're really excited about that new work that's going to be rolling out.
All right. Well, and it sounds like there's a HEN session right after that. Carol and I have a QIN session right after this, so this has been a busy day. Thank you, everybody, for taking the time to attend this call, and have a great afternoon.
Goodbye, everyone.
Bye-bye.
Thank you. This does conclude today's teleconference. We thank you for your participation. You may disconnect your line at this time.